Hi everyone, I'm Dr. Aleksandra Brown, I'm a board certified dermatologist, and welcome back to my channel. Today we're going to talk about neck care, because if you're like me, over 40, and you woke up one morning and realized your neck doesn't look like the way it used to, welcome to 40s and perimenopause. Let's talk about what we can do to slow that down. So today I hope to break down why the neck ages faster, what changes you're looking out for, and what can you actually do about it. Everything from at-home skincare to at-home devices to in-office treatments. Now before we dive into this topic, make sure you like this video, go back and subscribe to the channel so you get notifications on future videos. And if you found this helpful, you can also find me on Instagram and TikTok at Dr. Aleksandra Brown. Let's dive into this exciting topic. The skin on your neck is thinner than the skin on your face, which means that there's less collagen and elastin, and it's going to age a little bit faster. It also has less oil glands, so it dries out more easily, and we all know that dry skin looks more wrinkly. Plus, most of us have spent years forgetting to take care of our neck. You're doing your skincare every morning and every night, and we stop right about here and we're not doing the neck. So if you're somebody really young and watching this, please, please, please bring all your face skincare down to your neck, especially your SPF. And don't even get me started on tech neck. All this time spent looking down at our phones, left and right, we end up with these horizontal lines that are etched in and sometimes even hyperpigmented in darker skin tones. So staring at your phone, or if you're at a computer and your computer's down, is not very helpful. So how do you know if your neck is aging? If you're starting to notice some changes initially, this is what it might look like. One of the first things you notice is probably the horizontal lines across your neck. I see these in your 30s most of the time. I even have some patients in their late 20s with the horizontal necklines. This could be partly genetic, but most of the time I really feel like it has a lot to do with the tech neck because they're looking down, looking at their phones. You might also notice that your skin is looking thinner and more crepey. Sometimes there is sagging or loose skin on the neck area, and you might even notice some discoloration or sunspots, and this is most prominent on the sides of your neck. This is called poikiloderma or poikiloderma of Savant, and it's from not bringing down the skincare to your neck, especially your SPF. I have had many patients over the years come and say, I woke up with this rash, and when I look at their neck, they have discolored, kind of mottled pink and brown and white patches, and they did not wake up with it. They just happened to look at it that morning. That's been there for years. It's SPF on your neck every single morning, just like you're doing it on your face, will prevent that 100%. And another thing you might notice is those vertical bands. So if you're like in your 40s and 50s and you're just so excited to smile in those family photos, and then later on you look at the pictures and you see these vertical bands, those are called platysmal bands. It's from the muscle in your neck. It's called the platysma, and when you clench your jaw really hard to smile, they really pop up and become more noticeable as we get older. By the way, I have those really bad, so if you're watching this video, pay attention. They are injected currently, so they're not going to act up very much, but I tend to make mine really pop out, especially if I'm lifting weights. I call them my flying squirrel, and the flying squirrel needs to be tamed with Botox or Dysport or Daxxify. So now that you know how neck ages, let's talk about some easy at-home skincare first. Things you can do to help slow that down. Once we go over the skincare, we're going to talk about at-home treatment options like procedures or maybe even in-office procedures. First steps first, you have to use sunscreen every single morning. And I know you already heard me say that, but sunscreen protects against UVA, UVB, which UVA penetrates deeper and degrades the collagen and gives you wrinkles. So even on cloudy, snowy, rainy days when you're driving in your car, sunscreen on your neck is non-negotiable. I'm going to make it even easier for you. Just get a neck gaiter, one of those bandanas, and put it on your neck and chest when you're driving. I have one in the car. I use it every time I'm driving. I often get a question, which SPF is the best? And really the answer is the one that you're going to use. And how are you supposed to pick one unless you really try them? So try SPF. Make sure you apply it to your face, neck, chest, eyelids, ears, and if it doesn't irritate your skin, that's your SPF. And if you want more help with this, I have SPF series where I purchase this sunscreen and give you unbiased review, or if you have any other sunscreens you want me to review, make sure you comment below. I'm going to put my sunscreen video up here if you want to check that out. Make sure you're using retinol on your neck. Retinol or prescription tretinoin can work wonders on your face, but they can sometimes be too harsh on the neck. For example, I can use my tretinoin on my neck one night a week, and I have to sandwich it between 2 layers of a moisturizer. If you've tried tretinoin on your neck 2-3 days in a row and you get a rash on your neck and it gets itchy, you're not allergic to tretinoin, you just can't tolerate it because your neck doesn't have the oil glands that your face does, and it tends to dry out and get really rashy much easier than your face. The neck skin is much thinner, it's more sensitive, and with the less oil glands, stronger retinoids like tretinoin can lead to irritation, redness, peeling, or maybe even worsening of the appearance temporarily. But if you want to use retinol, you want to pick something that's really gentle, maybe lower concentration. You can pick a neck cream that just goes on your neck, but let's talk about a couple of retinols. They're very gentle that you can can use on your face and neck, or maybe they're just really good for your neck and hands. This one's going to come by no surprise. You guys have seen me use the Rock Derm Correction Firming Serum Stick many times. It's my go-to for my neck. It's really gentle. It's safe for the neck and hands. It can be used on larger areas, even on the chest. It's designed to target that rough texture, crepey skin, fine lines without causing any irritation. In the stick, I feel like I'm not applying as much. I just gently glide it up and down the stick, making sure I cover the whole area, and I do moisturize on top. This is very affordable. It's fragrance-free. The key ingredient is the retinol. It has some antioxidants and firming THPE. It tends to boost elasticity for firmer, more supple skin. Next recommendation here is the Versed Press Restart Retinol Body Lotion. It's really gentle encapsulated retinol that's designed to minimize irritation while supporting collagen renewal. It's really ideal for that really sensitive or delicate areas like the neck. It will promote smoother, firmer skin with less risk of redness or flaking compared to your traditional tretinoin. The key ingredient here is the encapsulated retinol, cocoa butter, and squalene. These are not the only retinols for the neck. You can really pick whichever one you're using on your face if your skin is really sensitive, or if not, use your tretinoin. Just whatever you're doing on your face, try to bring it down to your neck. Next step to consider in the slowing down the aging of the neck is incorporating peptides for additional firmness. Peptides are these short chain amino acids that act as messengers to trigger collagen and elastin production, which is crucial for keeping the neck firm and resilient. My first recommendation here is Elastin Restorative Neck Complex with Trihex technology. This one stimulates collagen elastin production, visibly tightening sagging skin. It will help brighten the skin and reduce some of the crepiness with antioxidants. It also helps hydrate, doesn't feel greasy. It's really ideal for that daily use. The key ingredient is the Trihex technology, which is a proprietary blend of peptides and active ingredients, the phytoene, the phytofluene, and flaxseed extract. My next recommendation here is the Shackley Youth Ageless Sculpting Wand for face and neck. These are clinically tested to relax expression lines instantly and also support collagen synthesis over time. Also has this really cool stainless steel roller ball that will kind of sculpt your contours while delivering the hydration and antioxidants. When I roll mine on, I have to let it sit a few minutes just for it to absorb completely. This will help firm and brighten and improve skin texture with continued use. The key ingredients here are the Power 8 peptide blend, the snow mushroom, the guava ferment, hyaluronic acid, and niacinamide. Now that you know all the skincare you should be doing, let's talk about some at-home therapy devices that you may want to consider. Red light is my first recommendation here. At-home red light therapy can help stimulate collagen production, speed up healing for smoother, firmer skin. I have the Omnilux Contour Neck device. This one uses the medical grade 633 nanometer, which is the red, and 830 nanometer, which is the near infrared LED light, to help stimulate collagen production. It's clinically shown to improve skin elasticity and firmness. It does help reduce the appearance of fine lines, wrinkles, and crepey skin on neck and chest. It may even help fade some of the sunspots and pigmentation and redness for more of like an even skin tone. Overall, this promotes healthier, smoother, and younger looking skin over time. It's also FDA cleared for the treatment of fine lines, wrinkles, and sun damage on the neck and chest. I often get asked about red light devices, and I say that they're cherry on top. Using red light, it's not going to take place of a sunscreen, and it's definitely not going to take place of your retinol. So I consider devices in addition to topical treatments and in addition to your skincare, not in place of it. When you look at the Omnilux red light therapy device, the two different wavelengths, the 633 is the red light. It penetrates deep down to stimulate the fibroblast activity and collagen production, improving skin texture and radiance. And then you also have the infrared or the near infrared, which is the 830 nanometer wavelength. This one works more to reduce inflammation, promote healing, and enhance skin recovery at like a deeper level. Now, let's say you're doing all this and your neck is still not where you want it to be. Let's talk about some in-office procedures that may be beneficial. First treatment I recommend is microneedling. Even though it's not very invasive, it's gonna help if you maintain your results. Now, when I'm talking about in-office procedures, I'm not saying come and do these in place of everything I've talked about so far. Definitely not. You still have to do your at-home skincare, maybe add at-home devices, and then in addition to that, add the in-office procedures. Microneedling is my go-to. It's the biggest bang for your buck. It is minimal downtime, relatively inexpensive, but it's going to take a series of treatments to see results, and maybe even subtle results. They're not going to be very impressive. Next step up from that are things like clear and brilliant lasers or even Fraxel. These are going to have a little more downtime, especially the Fraxel. They're going to be a little bit better with results that will help improve sunspots, texture, and overall skin quality. And it's not going to be one and done. You will need series of these as well, but you may be able to space them out a little bit bit more and need a little bit less of these compared to microneedling. The next in-office recommendation are things like Ultherapy or Thermage. These use ultrasound or radiofrequency energy to help tighten and lift skin non-invasively. Even though they're non-invasive, they can be pretty uncomfortable, and it's going to be maintenance. You may need to do this every year or a couple times a year. Another recommendation to consider is microneedling with radiofrequency. These can sometimes produce deep collagen stimulation for like the firming and tightening. In my personal experience, they tend to, in general, like Morpheus 8, promise a lot and not deliver much. I have personally not seen a lot of patients with good results from Morpheus 8. If you're somebody who needs a lot of tightening, Morpheus 8 isn't going to get it done. That might be a surgical job. But if you're somebody who's just looking to slow things down or maybe prevent those wrinkles from getting deeper, Morpheus 8 might be your thing. And if you're someone like me and you smile big or you lift weights and you feel like your neck turns into a flying squirrel look because those bands pop up, Botox can help with that, and it can last anywhere from 4 to 6 months depending how many units you get and which brand you pick. For example, Botox and Dysport typically last 3 to 4 months, whereas Daxxify, you might be able to get 6 months out of it. If you're somebody with horizontal lines and nothing fixes them like filler. Filler does an amazing job at smoothing those lines out, filling them in, making them almost invisible. It's very satisfying because it's instant gratification, but it can bruise. You guys, that's all I have for you. Neck aging is something almost all of us are going to experience if we live long enough, but there's so many ways to slow it down or even ways to reverse some of those early changes. If you start early and you're consistent with your skincare, don't forget those little habits add up over time. You can totally prevent a lot of those things that I just talked about, especially the sun damage and discoloration. Hope you found this video helpful. Feel free to drop any comments you have below or future topic ideas. You guys can also find me on Instagram and TikTok at Dr. Aleksandra Brown. That's Dr. Aleks, no X. Make sure you like and subscribe for more tips. Thanks for watching. I'll see you next time.